Hi everyone, welcome. My name is Anne-Marie Towers and I'm a Professor of Social Care Research and Deputy Director of the Health and Social Care Workforce Research Unit at King's College London. Today I'm going to be presenting work I led at the University of Kent as part of the ASCOT programme of work. Before I begin, I just want to acknowledge the input and expertise of the whole team, including our collaborators at Ipsos and Skills for Care. So a little bit of background. The ASCOT workforce measure was developed as part of a larger project to create a survey focused on well-being of the adult social care workforce in England. The survey was led by Ipsos Mori and commissioned by the Department of Health and Social Care in collaboration with Skills for Care and the University of Kent. And essentially it aimed to inform policy around the adult social care workforce, especially quality of life and well-being. This is important because previous research has shown that as well as being an important outcome in itself, well-being plays an important role in productivity and staff retention. So the triangle of care recognises that to achieve the best outcomes for people drawing on care and support, you also need to support the needs of both the unpaid and paid carers. Those of you who are familiar with the ASCOT programme of work will know that the ASCOT measures were originally designed to measure the impact of social care on the care-related quality of life of people drawing on care and support. Over time, the ASCOT carer measures were developed, and these capture the impact of social care on the quality of life of the family or friend carer. Used together, the ASCOT and the ASCOT carer measures help us understand the impact of services on care dyads, including recognising the important role family or friend carers play in improving the outcomes of the people they support. Although research shows a significant association between care-related quality of life, working conditions such as pay and training, and indicators of care quality such as regulated quality ratings, until now we have not been able to capture the work-related quality of life of the workforce themselves. Yet this seems critical if we want to attract and retain a happy and highly skilled and motivated workforce. And this really was the motivation for developing the new ASCOT measure, the ASCOT workforce. So following best practice approaches to questionnaire development and building on previous work, we began with a rapid evidence review before undertaking focus groups with the sector to explore and test survey content. We then moved into questionnaire design, drawing on previous ASCOT questions and the framework or approach, and moved into cognitive testing, which included 20 interviews across 2 rounds of testing with people working in different roles in the adult social care sector. These interviews were really important in ensuring the questions were understood as intended and that response options were appropriate. Finally, we moved into the survey itself, and from there we undertook psychometric testing. So I mentioned that we undertook a rapid evidence review. But previously, we'd undertaken an international scoping review published in 2022. There's a reference there for it, which examined how work-related quality of life had been defined and measured in adult social care and similar professions internationally. As part of that review, 7 measures were identified as potentially relevant to the adult social care workforce in England. The review ended by suggesting that their quality and relevance be assessed. And this is what we undertook as part at the start of this particular project. We assessed 5 of the 7 measures for their psychometric properties and suitability for inclusion in the national survey. There we considered things such as their length, but also their relevance to the UK context. Following that rapid evidence review, 1 measure was included in the wider survey. This is called the Work-Related Quality of Life Scale by Simon Easton and Darren Van Laar. However, we also felt there was a case for a new measure. And the reason for that was that none of the measures included in the review were suitable for use in economic evaluation, whereas, as you'll know, the other ASCOT measures have been preference weighted. Furthermore, none were designed specifically to measure the impact of working in social care. During the interviews and focus groups that we undertook with the workforce, it was clear that there were aspects of work-related quality of life that were really important to capture in this population, particularly things that are relevant to the nature of the caring role. So, for example, feeling you're making a difference to someone's life, the relationships that you have with the people you care and support, having time to care for people, but also having time for self-care, feeling valued, and worrying about those that you care for in non-work hours, that kind of spillover effect. There were also some other aspects of work-related quality of life that we felt were particularly salient for some roles. So things such as financial security, this picks up on issues around low pay and irregular working hours, career pathways, investment in training and skills, and safety. So this is safety from harassment, abuse, and physical harm. We ended up with 13 domains that arose from this qualitative work and consultation with the sector. I'm just going to read them out one by one. So, making a difference, relationships with people supported, autonomy, time to care, worrying about work, self-care, feeling safe at work, professional working relationships, feeling supported by managers, skills and knowledge, career path, financial security, and valued by society. I won't read these out, but here are a couple of example questions. And as you can see, these follow the standard ASCOT framework, which is one question per domain, followed by 4 response options corresponding to 4 different outcome states. And these outcome states range from the ideal state at the top, all the way through to high needs at the bottom, which is serious enough to affect a person's physical or psychological well-being. So following a pilot, the main stage of the survey was conducted between August and October 2023. The survey was conducted online by Ipsos, with Skills for Care disseminating the survey across their networks, and a telephone option was also offered for those who wanted it. Quotas were set for job role, service type, employer type, gender, age, ethnicity, and region. And these were closely monitored during the survey, and Skills for Care's dissemination efforts were adjusted accordingly as the fieldwork progressed. All in all, we ended up with a data set of 7,233 cases, which was really fantastic for the first wave of this survey. So for the psychometric properties of the new measure, we focused on the construct validity, structural validity, and internal consistency of the new measure. So in terms of construct validity, this is how well the tool measures the concepts it's intended to measure. And here specifically, we looked at the convergent validity by testing hypothesized associations with other similar measures, such as the Van Laar scale that I mentioned earlier. Good news was that over 75% of the hypotheses were accepted, which is considered good evidence of construct validity. The next thing that we looked at was structural validity. Now, research has consistently shown that the other ASCOT tools form a unidimensional scale, meaning the items are loading onto the same latent construct of social care-related quality of life. As this was a new scale, we examined the structural validity of the ASCOT workforce using exploratory factor analysis, and found evidence of a unidimensional scale for all workforce subgroups, with a couple of exceptions. So the domain skills and knowledge had low factor loadings for 2 subgroups, and these were occupational therapists, nurses, and allied health professionals, and direct care workers in nursing homes. The other domain was financial security. Now this had slightly low factor loadings for 1 subgroup, and that was again, OTs, nurses, and allied health professionals. Now overall we felt there was insufficient evidence to drop or modify the items now, but certainly this is something that we will explore in future research. So finally, I'm just going to move on to internal consistency. Now, this evaluates the reliability of a questionnaire by examining the correlations between the individual questions meant to measure the same construct. And here we found evidence of very good internal consistency across all subgroups. Cronbach's alpha, there, as you can see there, ranged between 0.83 and 0.87. This suggests that 13 items are closely interrelated, adding to the evidence that they measure the same underlying construct. So taken together, pretty good evidence for the psychometric properties of this new tool. So in terms of summary and next steps, the papers are in draft at the moment, and these will be out soon. But just to recap on the work that we undertook here, when we started, there was no existing measure of care work related quality of life of this workforce. The literature review, focus groups, and cognitive testing supported the inclusion of 13 care work related quality of life domains. And the survey included people with direct care roles, managers, social workers, and health roles working in different social care settings, for example, nurses and occupational therapists. So the measure was tested right across the social care workforce. Exploratory factor analysis has found preliminary evidence of a single factor structure, just like the other ASCOT measures, good internal consistency, and construct validity. So as part of future work, what we plan to do is develop a short version of the ASCOT workforce, so slightly fewer domains, and then undertake some preference weights, collect some preference weights, I should say, for this population, so that the measure can be used in economic evaluation, just like the other ASCOT measures. And obviously, long term, one of our clear goals is that the measure be translated for use in other countries. Thank you ever so much for listening. Do keep an eye out for the papers. When they are available, we will be posting them here on the ASCOT website and also sharing them on social media. Finally, if you'd like to get in contact with us about the measure, you can contact me, Anne-Marie Towers at KCL, or on Twitter. You can take a look at the measures and the guidance on the ASCOT website. And for those of you who are thinking that you would like to use the ASCOT measure, you will need to apply for a license, the same as all of the ASCOT measures, but as you know, they are free for not-for-profit use. It's just a matter of keeping a track of who's using it so that we've got that information for recording impact. And finally, last but not least, I just need to say that this research was funded by the Department of Health and Social Care, that the views expressed here are those of the research team and not necessarily those of the department. Thank you very much.